All right, so let's get going here then. For MD coaches, I'd like to welcome you to Inside the Doctor's Lounge. And I'm your host, Dr. Desmond Bell, with my colleagues, Dr. Rick Zollinger, Dr. Randy Cook, and Rhonda Crow, the CEO of MD Coaches. So Inside the Doctor's Lounge, if you're not aware of what this is all about, it represents a place where physicians can come together and talk on any number of topics in essentially the setting that you would find inside a real doctor's lounge. There's no fear of repercussions. We can be honest, and there's no safety net. So with that, I'd like to kind of get things going. We have plenty to talk about. We never know where this is going to go. And it's kind of a reflection of what goes on inside our crazy little minds here. So I think you'll enjoy this, and we certainly look forward to having you involved in future episodes. So, obviously CV-19 has made a real impact on a lot of us, on all of us. And one thing that I just came across over the past week, and Rhonda shared it with us too, and I did a little more digging on it, was the University of South Carolina has informed their medical students that they must sign a waiver to essentially release the university from any issues related to the students contracting COVID-19 during their rotations and clerkships. If they don't, they will not be able to graduate this year. So to me, this opens up a whole can of worms, because I know when we were students, HIV was just emerging essentially. We had the fear of hepatitis, and I don't remember having to ever sign a waiver such as this. So I'm just concerned that if the students do indeed sign this waiver, is this going to create a whole new precedent? Because there are going to be other things that were going to come down the pike. And if you're doing this for CV-19, then why not for some of the other conditions? I mean, after all, you go into medicine, you're going to be exposed to anything and who knows what. So you guys have any thoughts on this?
Well, that was exactly when I shared the tweet. That was exactly my concern too, Des, was what makes this so different? And I don't mean to simplify, and certainly I don't have all the knowledge that's out there, but I just don't understand how this situation is any different than what you mentioned that we've dealt with before. Why would it create, obviously I understand why it would create some concern, but why do we need to go to that action, and what compelled the University of South Carolina to take such an assertive step with their medical students, and what was the vision long term? What's this going to do not only with current class but enrollment? Is it going to discourage others from taking a look at their institution for their education? I don't understand the action.
I mean, first of all, I don't understand the action. Are there going to be other schools that follow? And do they realize even what they're doing in this? How well was this, really thought through? Because, I know we live in a litigious society. At some point, where does all this end?
Clearly, somebody thought that MUSC needed to be protected or limit their liability in some way, although I can't imagine why. And then the next question for me is exactly what you've already brought up, and that is, are other medical universities going to do it, or any other universities, period?
Well, I
assume that they are concerned because if you are a medical student, clearly you're going to be exposed to some sick people. But my goodness, that's not new. A residency colleague of mine got hepatitis, and no doubt he got it from a patient. Well, I guess it's not. Could have gotten it someplace else, but you get exposed to pathogens, and you're at some risk. So I don't I don't get it at all.
And what's the domino effect here too? We're talking about medical students today, but there's nursing students, there's social workers, there's all the other disciplines that are being exposed to these patients as well and their care. So where does it go from there?
I think it's all political. I think it's, to me, it's the time we live in. Mainstream media, CYA. I mean, if you just heard the other day, the University of Michigan president says, well, and remember too, that these are state institutions. So South Carolina, University of Texas, University of Alabama, they're gonna put out there whatever like this. The University of Michigan came out and he says, well, we probably going to go online through the fall and probably for the next year then. Now, how does he make that comment right now anyways, without being able to revise it? And in fact, the medical school, the nursing school at Michigan State has the nursing students doing their clinicals online. Now, how do you do that?
That's
you listen to the chest, guys. I mean, come on.
That's just ridiculous.
So I agree with you. I don't know. I mean, I can't.
How would you like to be, the thing too, how'd you like to be a student now? You've already invested how many years in your education? You're moving right along. This incident comes along. So your options that you're presented with are either, okay, you sit out your clinical rotations right now in clerkships, but if you want to continue on time, well, you're going to have to sign this waiver over. Where does this really end? How do we even know that this virus is going to be completely gone a year from now? So is it going to just, delay them a second year? I mean, there's no end to this, but I mean, really, if I were a student right now, I'd be furious. Your life is being put on hold, and there's based on what really? And so because some lawyer did this, and this is more CYA at its best, it just makes no sense. It just, I'm pretty outraged for the sake of the students there. They are really being, their career is being hijacked in a sense right now.
Well, I'm going to say one thing somewhat prejudicial right here, and that is, I bet you this idea didn't come from some physician. I think you're right on. It was either a lawyer or an executive of some sort, a non-physician executive of some sort that had a conversation with a lawyer, and they get in a room and they think about all the ways that the skies might fall, and then, okay, yeah, we better put that clause in there. It's
so who's representing the students right now? I mean, the university is going to make some BS statement, say, oh, well, we have our students' interests in mind and all this nonsense. The kids need to they need to either band together and get an attorney on board, because I can't see how this is, how this can even hold water. This stinks.
I'll tell you something else that's interesting. So Charlotte, we're on the state line. So from right here, I get my car and go 45 miles an hour, and in 5 minutes I can be in South Carolina. So on the news, we hear the governor of South Carolina news and we hear the governor of North Carolina news. So we get to hear both press conferences. We're opening up. And the South Carolina governor their state is open. Okay, this is interesting. South Carolina, they opened up a week ahead of Memorial Day so that the beaches would be open, the bars and restaurants could set up outside, elective surgeries could go back to normal, places of worship were starting to open. I mean, this is South Carolina, that's what they're doing. So it's interesting that state with a state institution would come out and make this statement. And I think, Randy, I think you nailed it. It comes out of somebody at the upper levels. The legal team says, well, we need to be careful how we manage this going forward. And I think you're right, Ron. I think it opens up. You can't, if you do this, somehow legally, if somebody challenged it and took it up through the steps, I'm sure it would get struck because.
I'm curious now too. Are these students the ones who decide that they're going to sit out this year? And have to graduate a year later. Now they're apparently going to have to pay another year tuition, I would assume.
Yeah.
I mean, that's
an interesting thought. Cost.
So, where does
That
this?
is a good question.
I mean, I can't see the university being so generous that they're going to waive tuition for those students. I really can't imagine that they would. They'll justify it.
Well, if they're sitting out now,
But Randy,
I guess it depends on who decides if the university is going to allow them to sit out and they haven't provided a service, then I don't think they're entitled to collect the tuition. I don't know. There's so many things that this pandemic has. So many roaches have run out from under everything that we pick up. You just don't know where it's going to come next.
Yeah. I'm just, considering that the university, well, you had the option. You could have graduated on time if you would have signed the waiver, but you chose to sit out. So that was your choice. And now you're going to have to pay the additional year's tuition or whatever. I could just see it coming. You could just, the whole thing stinks. I'm telling you.
What does it do for placement too? If you are a student who's decided to sit out, things, settle down, we have a vaccine, everybody's vaccinated, and you can get back to work. What does it do for the next class as far as placement and having a place as they move forward? That stops momentum. It stops progression.
It creates a problem.
Yeah. I'm curious too to see, of the class, how many students have signed that waiver and who has, because they probably said, look, it's March or April. We're a month from graduation, for crying out loud. We're gonna have to do a whole year over again just because of this. I'll take my chances. And now the university, they're covered. They're free from any kind of potential issues. So it's just
Well,
so devious.
The interesting part too is the young lady that we were going to try to have on this, I guess. And one of the things that she had to do was she has to go out early to St. Louis and then basically self-quarantine both on her move, and then she has to prove when she starts her residency she self-quarantines again. It's like a month. So, and then she's going to go work in the hospital. So, I thought, well, I get that. I understand that, but
that at least has some logic behind it.
Yes. Yeah. I mean, that at least has some logic.
It does. It's interesting. I just made me think of when our guys went to the moon the first time. They were in quarantine. It was only 2 weeks.
I know. Yeah.
So those poor guys sat in that trailer for 2 weeks.
I forgot that.
Now you think of the quarantine that's going on here. Anyway. It's I know that there are some silver linings that will come from all this, but right now, when you see the this type of an action that's taken by the university, though, I don't know whose interest they're really looking out for other than their own. And it's just, again, I guess they're thinking they're being proactive, but it's really, again, I say it's not well thought out. And, it's kind of like we talked about it another time too, about some of the uncertainty in medicine and what's going on. And just, again, it kind of reflects on, it's already setting the precedent how doctors are viewed. Again, we talked about doctors now being viewed as commodities over and over again. Okay, students, here you go. Here's your first taste of it as to what could be coming. So
I think it's a horrible crossover that four of us never really have seen. I guess I didn't even understand what true public health was or public health degree, where medicine, where this whole thing is moved on from medicine into, and I don't even call it public health. I don't even know who's in charge. And I think what people find, and I tell you, like I told Rhonda, you go on Twitter and people like the young lady we're talking about, they're afraid. They get on there and they rant and rave, and then They pick on each other. These are residents and young staff people.
Oh,
And
yeah.
because they're listening to what the public reports about what they do in their place of work. I just going, that's just get out of here.
Yeah, public health, the healthcare has gone from taking care of the individual to looking at populations. It's really population health now. So you're kind of lumped into a category, and that's how you're treated now. So some actuaries got together and they crunched numbers, and the administrators kind of all get together too, I guess. And
we've had a remarkably free ride, a remarkably long free ride. It was only around the beginning of the 20th century, I guess, that we really began to have an effective understanding of infectious disease. And actually early in the 20th century, when they had the so-called Spanish flu epidemic, they realized that they didn't really know what to do with it. And interestingly, in that era, they just covered the thing up. I mentioned in one of my blogs that the president absolutely never mentioned that there was an epidemic going on in the 1918, 1919 period. But we got better at it, and widespread outbreaks of fatal disease have been relatively rare, with the possible exception of influenza, which we feel like we have pretty good control over. But this whole thing of a widespread novel virus has put us into a situation that we haven't faced probably for a couple of 100 years. It's something we don't fully understand. And the only weapons that we have at our disposal that can come anywhere near to bringing about some control is to control human behavior. And that is a tough thing to do in any set of circumstances, and especially in a nation that prides itself on its freedom. So,
Amen.
We're truly facing something that we've never dealt with before, and it's just going to be a day-to-day unfolding of experiences. So hold on, guys.
Toss in the airplane.
How's that?
I said, toss in the airplane.
Oh, yeah. Lord, I'm cringing at my first flight experiences coming up.
Yeah, you can't block up. You can't lock up the doors. You used to be able to do that theoretically on a country. If you go back to 1918 or whatever, but you can't do that anymore. How do we know that the guy gets on an airplane in El Paso and goes to Rio and then boom, boom, boom? First time we ever saw it was with AIDS from South Africa, right?
Correct.
So this is just, and even now, it's just hit the South American continent, it's exploded down there. So it's that part's kind of fascinating to me.
And we actually have at least one episode that I know of where we were fairly successful, and that was Ebola.
Yeah.
But again, circumstances don't match. This is something that is just so incredibly contagious, which was not the case with Ebola. You had to have fairly close personal contact in order to pass that one. But this is one where standing too close to somebody in the grocery store line can get you sick, and that's.
But here's the other one. Statistically, still go back through the statistics, and of all the deaths, 50% of the deaths are in nursing homes. Take that number.
Sure.
So when you go to the clientele under 70, 99.5% recover. So I have a hard time with the reporting of the statistic. I sound like Jody.
No, well, we're obviously learning more about it each day, even statistically looking at certain groups. And I think the thing that's really throwing people off, we kind of anticipated, as with the flu, some of the elderly high risk populations would be most susceptible. That was a given. But the way it's hit some of the younger people who would appear to be in otherwise good health, and it's been so debilitating and deadly in cases, that's what's really scaring people, I think.
And
Yeah,
rightfully so. And that's something that I've talked about before as well. And that is this thing is so new that we don't actually truly understand the details of the pathophysiology.
that's right. That's
You know,
right.
I
Yeah,
mean, we know that everybody gets pneumonia, but so many other things that are unrelated to the pulmonary system are
That it's a
clearly,
mutating gene,
yeah,
right?
yeah.
yeah, well, and that's another thing
A
too.
rapidly mutating virus.
So, I read an essay yesterday from an ICU doc, and basically he was non-judgmental in any of this. He's just kept it really clinical, and said the things that he's been seeing, mostly the ones who have been the most susceptible are the obese patients, which was really interesting. I've read other things that, the homeless population, who are hardly practicing any kind of social distancing or, I guess hygiene, I'll even go as far to say that, seem to be less affected by this too. So, that's why everybody's so perplexed. And which way do you go with this? How, we've taken immunology. We understand how the body reacts, how you build your immune system, how, we've all functioned in hospital settings for years, and probably, I would guess that you guys probably rarely got sick in the course of your career. We maybe have a day you're not feeling so hot. We get our flu shots. We take precaution, but generally we've been exposed to so many crazy things. And I don't know, is it our immune systems that have reacted to this too? There's so many questions I have about this. And so, it's like, panicking and fear, I guess I am not one of those people to overreact to things anyway, pretty even keel along the way. Maybe it's because it's of our education and what we've learned over the years as students and then providers. But, this is really, Will Lee, who's one of our colleagues in the wound care world and research, Will's involved in CV19 research right now. We were talking a couple of weeks ago, and he said to me, he goes, I look at this and how little we've evolved as a species, as people, because back in the dark ages, in the Middle Ages, when you had the plague going on, people just waited inside their house and just waited for somebody to say, okay, it's safe to come out now. And that's pretty much what they did. And so here we are, kind of similar situation or scenario.
What I'm going to really fascinated medically is I want to know what is going to be the true analysis of the statistics when we go back. I don't understand, and without thinking politically, I don't understand why New York City was this humongous epicenter. That I don't understand why.
I actually think that's pretty easy, Rick.
Well, just because of dense population. Well, then why?
Absolutely.
What was the shutdown, and why not in Beijing and Shanghai?
Well, the difference is because the Chinese were much more capable, and without anybody asking any questions, they were able to shut things down, and they had a much better system of contact tracing. And from a standpoint of public health, they did a much better job of finding the cases and keeping people separate. New York, I think, is unique for two reasons. One is the density of the population, the way people live, particularly in New York City. And the second thing is that there are 3 international airports there that have not only passengers, but employees that come in contact with passengers that are very capable of transmitting an infection over a vast area in just a very short period of time. So the combination of the dense population and the number of people that are passing through the transportation hub, I think, is an absolute a perfect recipe
That,
for
that's
exactly
that's
what we
a
see.
yeah, that's really interesting, Randy. New York. I grew up in the New York metropolitan area, and now I live in Florida. So kind of bear with me on this. One of the things we saw down here in Florida, especially down to Orlando and South Florida, where New Yorkers were escaping the city at the beginning of the outbreak. And so our biggest hotspot for the outbreaks happened to be like in Miami, although it was not crazy. Jacksonville, far less, far less. But New York. Let's look at the city. You've got New York City and North Jersey, two of the most densely populated areas. But yet New York also accompanies upstate New York. So I'd love to see the comparison of statistics for what was going on in the rest of the state versus the city. And Randy, your point about the access to the transportation hub, that's a big part of this too, for sure. All the international travel between JFK, Newark, LaGuardia, it's for real. I mean,
And
it's
Rick, you mentioned
What about
the
Philadelphia and Baltimore?
well, you mentioned the impossibility of distancing people on a modern day jet aircraft. That also points to the way that people travel around New York City. And if you've ever been on one of those subways, you know what I'm talking about.
Yeah,
It's an entirely different way of life, and I
truly
think for
is.
that reason we shouldn't be surprised that it has been so widespread there, and indeed
I'm not surprised,
upstate.
but I would
It's
like to
not.
see the statistics on Baltimore and Philadelphia. Aren't those Metro New York? And they don't have those same statistics.
Yeah, the nursing home thing and the way that handled, for sure, that had a big impact. That was like lighting a
They
match.
sent them back to the nursing homes.
Yeah, I mean that, no doubt about that. It definitely, Philly, I know, has had issues. Baltimore, DC is still a hotbed too, but that whole eastern seaboard and that region is, again, most densely populated area outside maybe Southern California. So you can't escape it. In all my friends and family that are still living up there, they're going crazy. They're ready to lose it up there.
I bet.
They're just
The saddest part to me of all this is, and you guys, I know you do, Rhonda, we still have an elderly mother-in-law. Well, she's in prison. She's not in a nursing home. She's in prison because basically she is allowed in her room since 6 weeks ago, and they say maybe we'll let you out of your room Labor Day. And the only way to get out of your room is to fall, hit yourself over the head, or do something to get yourself to the hospital. And I feel so bad for those people.
So that would be going from a maximum security prison to a not quite so maximum security prison.
I mean, I feel absolutely awful. I mean, the girls call her every day and speak to her daughters, but that's something that's come out of this that I really feel bad for, because that's nationwide.
I've known a very small number of people, and the reason for that should be fairly obvious to us, I guess. But a small number of people that I know have taken a family member out of the nursing home environment into their homes. And if you've got enough extended family that you can work it that way, that's wonderful. But I think that is probably not the case for all but a tiny fraction of people.
Small fraction. Absolutely. And then we're starting to see more issues now with the isolation, the depression setting in, which is becoming a much bigger issue than potentially being exposed to the virus.
Of course. I mean,
we are social. Bad.
We're social creatures.
Yeah, her mother's conversation every time you talk to her is, "I just want to die."
Yeah. Well,
she's totally with it.
The mindset changes.
You have to have something to look forward to every day when you get out of bed or when you open your eyes. There's got to be something.
Well, the thing is their activities, even if they were, locked within the building themselves and still could keep their own population healthy and be active with each other, that's one thing. But they're not even allowed to do that. They're held in their room, which, to your point, Randy, is a cell. It becomes a cell at that point. And the only social interaction is when two masked people deliver a meal to you.
Yeah.
That's it. That's all you get. And whatever comes to you through the television, which happens to be death rates every day.
And
yeah, it's doom and gloom constantly.
Yeah.
And therein brings, Des, what you said, because for me, I said to my sister-in-laws and my wife, I said, well, I can't believe she's in a really good place, my mother-in-law. If they're so good at doing all this, why they can't have a little thing with their hallways, get to go to the room and look out the window or open the door or whatever. But if you go back to the original nursing home in Seattle that had the outbreak and 60% of the people died or whatever, and the lawyers have descended on the nursing homes, like pressure ulcers or whatever. And so they're just in lockdown mode, and they have to be.
But even with these measures, they can't keep family members completely away. And I'm going to tell you, I've observed it myself. I'm very fortunate. My parents are in a condo, which is in a retirement community behind a larger building. That's what they opted for. They're isolating in their condo, but they have much more freedom than those who are residents of the larger building. But on a sunny day, I see cars parked behind the building. I see adult children walking, milkshakes and ice cream sundaes up to the window and passing it through the window. I see another adult woman talking to, I'm assuming, her mother through the window, but it's a screen. So
but see, the one my mother-in-law is at has that, and you're staged. That's one of the things. If you left, like we were talking, Randy, you've given them your $250,000 for life or whatever. So my mother-in-law lived for 10 years in a 2-bedroom little house, had everything. Then she moved into the main building, had an apartment. Then she moved into this. But the way they have it, you come through it's a gated community, so to speak. So you can't even get on the grounds as a family member unless they have called you to come and bring something or interact somehow. So
what this underscores is something that I'm probably going to be doing some more blogging about, and that is what we're talking about here underscores the ridiculously inept system of public health that we have in this country. And immediately that separates everybody into the two camps. There is this is a free country camp, and nobody should be trampling on my freedom. And then there is the other one, the other side, that we have a responsibility to take care of each other. But be that as it may, whatever the right answer to that is, this is a striking example of how poorly we have done it. There is not any president, there is not any administration, there is not any Congress for the past 100 years, in my opinion, that escapes blame for this. I'm not talking about the present administration. I'm talking about all of them that go back as far as I can remember. And I remember, I bet you do too, Rick, the polio epidemic in the 1950s. And we handled that one fairly well, but this one is different because of the level of contagion and the speed of the spread. But other countries have done it way better. South Korea, I think, is a really good example. They had a system of public health workers, people that were employed strictly for the purpose of dealing with situations like this. They were able to trace contact and isolate contacts, and that is a much better way of controlling something like this than locking people in their homes and telling them that you can't come out. It makes people angry. It makes them inclined to do irrational things. And we ought to be able to do better than this. And do I have the answer? No, because whatever answer it is going to have to be something that satisfies both sides of that argument. And we are at a particular time in our history where nobody is talking anymore. We're just shouting at each other, and that is not going to get the job done.
No, it never does. And, Randy, you actually have given us some more ideas to think about for future topics. on the Doctor's Lounge. And I want to leave on that note. I hope our audience has enjoyed this program today. We love doing this, and we hope that you'll join us again inside the Doctor's Lounge with Rhonda Crow, Randy Cook, Rick Zollander, myself, Dr. Desmond Bell. For MD coaches, just remember too that we see you, we hear you, and we believe in you. Until next time, take care.
See you next time.
Thanks.
Very good.
I personally loved our discussion today inside the Doctor's Lounge, and hope you did too. The whole idea of medical students having to sign a waiver in light of the COVID pandemic is just really mind-boggling, and it opens so many other possibilities. Inside the Doctor's Lounge is a place where we can all come together and discuss ideas freely without fear of repercussion, just as it would happen in a real Doctor's Lounge. So I hope you enjoyed this today. Obviously, we had a lot to talk about, and we welcome your ideas, thoughts, anything you'd want to hear us talk about, and maybe you'll find yourself being invited to be part of our forum one time. So until then, this is Dr. Desmond Bell on behalf of my colleagues Rhonda Crow, Dr. Rick Zollander, Dr. Randy Cook, for MD Coaches. And remember, we see you, we're here for you, and we believe in you.